This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
All right, perfect. Hi, I'm Kent Simmons. I'm one of the chief residents from UT Southwestern. I'd like to thank everyone for taking the time to listen about our program and for their interest in PM&R in general. A little bit about our program. It was first established in 1977. It's a very large PM&R residency. We have 9 total spots, 6 categorical and 3 advanced that will be moving towards 6 advanced in the near future. We've got a pretty broad curriculum. It's a very friendly, easygoing learning environment. We've got a good variation of patient populations, and we'll get to that later across the different training sites that we have here. And overall, it's primarily more of a resident-run, very hands-on program. The leadership of the program, we have Dr. Kim, who is our chair. Her background is in pediatric PM&R and focuses on spasticity and cerebral palsy. We also have Dr. Scott, who's on the call as well. She's the PD, and our glorious program director, Terry Isabel, who's won numerous awards for the work and dedication that she's put towards this program, as well as the associate directors, Dr. Kasilanan, Sharma, and Kumar, and then the 3 residents, Alia, Sam, and myself. Just a little bit about Dallas for those that don't know. It's actually a very large city. It just surpassed 8 million in 2023. It's also been ranked as the fastest growing metro area in the US. And it's actually a very diverse city too. It's the 4th most diverse in the US, and it's got a very large international airport for those that like to travel like myself, or for those that have family across the country and want to make sure that they can get out. You can see some pictures here of the skyline, and then it's considered Dallas-Fort Worth. So Fort Worth is about a 40-minute drive away, and in some ways is a separate city, but closely linked. And then a little bit about UT Southwestern. It's the largest medical school in the US. And the residency program here across for the whole institution is very large. It's actually the 8th largest ACGME program, ranked by the number of residents and fellows. It's consistently ranked in the top 25, both in primary care as well as research. And both nationally and internationally, it has a very strong research reputation. And it was ranked number 3 by the Nature Index globally. And then a little bit more about the program itself, and for those, for the 6 categorical interns in our schedule right here. So the intern schedule is sort of, it's a mixed thing. So, we have, I think it's 3 or 4 rotations with internal medicine, as well as the hospitalist consult team. And this is very important because you're never going to escape medicine, even for those that want to go into MSK or pain. And everyone should know the good hyponatremia workup. In addition, we do 3 rotations with emergency medicine. At first, I wasn't too sure what to think of this, and I did the categorical program here, but I found it very beneficial, especially when you're on nights and yourself in PM&R, and being able to identify patients, being able to appropriately triage patients and take care of them and be able to transition them to where they need to be is an immensely helpful skill to know. We also have a close relationship with the neurology team, so we're able to rotate with general neurology in the hospital, as well as their stroke service. And the other interesting thing, we do a short rotation with the what they call the emergency department neurology team, and so that kind of helps us get some hands-on experience with the management of stroke, seizure, myasthenia crisis, all of these things that again may present to themselves when you're overnight. So knowing what to do, what to call, what to look for is very helpful. We do a rotation with neurocritical care, and then we also have 1 month of surgery which to me personally was a great opportunity, because for trauma surgery or burn surgery, it was great. Get your hands on. It's a busy week, busy couple of weeks, but it was great to kind of see it firsthand on how these things are managed, but not long enough that the burnout set in too strongly. We just also have interests with radiology, and then we also get some early exposure with both inpatient and outpatient PM&R, which is helpful because being an intern, you're kind of with the PM&R program, but you're kind of not. So having those few weeks where you get to kind of merged in with the program is very helpful as interns. A little overview of the schedule. So the PGY 2-year, as with many PM&R programs, traditionally is very inpatient heavy. So most of these rotations right now, these stars donate inpatient blocks, and there's going to be some transition over the coming years to try to get a little bit more time with electives during this. So you do SCI. This is over at the VA, and I'll get into the different training sites a little bit later too. We also have 2 general IPR rotations. This is at Parkland Hospital. And then we have a couple of rotations with brain injury. We have some experience with consults, and then an inpatient rotation with children's IPR. And then there is a night float of 3 weeks, which I'll get to on the next slide, as well as some time for some selectives. In the 3rd year, still get into the consults. Here we get to be what we call the consult boss, where we get to kind of take more of a charge and kind of lead and triage who needs to be seen, and take that leadership role, which is very helpful as we kind of transition, if that's what people are interested in doing. We have good opportunity to work on the outpatient side now with children's. So still 3 weeks of night float as a 3rd year. The one primary inpatient rotation as a 3rd year right now is the medically complex service or transplant service. We also have opportunities at the VA with outpatient, and then 6 weeks for those that are interested in procedures with the spine team. And then we have 2 blocks with EMG, one of which is led with the program director, Dr. Scott. And then 4th year, we do get an opportunity to work at Presbury, which is a private IPR, which is helpful to kind of get a step away a little bit more from the academic side and kind of see, for those that are interested in more of the private IPR hospital model. There is one more senior block of EMG rotations, more consults, and a little bit more time during this for selectives and research as well. And there is also just generalized PM&R clinics. And then, yeah, the important pieces too. So on the 4th year, we do have no call and no weekends for that PGY4s. The didactic schedule that we have, it's over 12 months. It's typically, we just changed it now to be every Tuesday. And we do get protected time, so no pagers, no calls. The attendings take over that time, so we can kind of focus on our learning between 8 to 12. We do get opportunities for anatomy. We have panel discussions, which could be interesting. So we just had a discussion by legal counsel that came in to kind of help us. How do we protect ourselves? What are the steps that if we get a deposition? So hopefully something none of us have to go through, but if we do, it's nice to have that background. We also have some workshops with that. So we do have a few rotations where we get to do ultrasound and get injections in the cadaver lab, which is helpful. I personally much prefer injecting cadavers for the first time than patients. And I think even just kind of knowing the steps of when you pick up the needle, when, how you draw up, how you glove up with all these opportunities, it can be awkward at first. And so having cadavers is very helpful compared to patients. We do have a specialized MSK curriculum, ground rounds, and then of course there's a journal club. And the nice thing is too, we do get free breakfast during this time. One second. Yeah, overall, didactics and our program itself, we like to think of ourselves as a very hands-on program. So that can be either if someone in the floral lab, we have great opportunities where the attendings trust us to kind of take a more leadership role and hands-on experience if need be. We also have a specified MSK injection workshop that's led by Dr. Merchandani, which is very helpful to have that sort of structured base. There's also opportunities for those interested in sports, numerous sports coverages. as well as at one point we were covering for the U.S. Paralympic swimming team, which is helpful, as well as more traditional
This
high school
is
athletes.
UT Southwestern. I don't know if UTSW.
Sorry? Oh. Okay. The call schedule that we have. So the nice thing about being in a larger program is that we are able to share out this call, which makes it really quite manageable. So we do in-house call, which personally I sort of like, because we kind of, as some of us say, we can condense the suck as opposed to doing more drawn out elements of home call. So PWI2, we have 6 to 7 calls, and these are the 28-hour in-house calls. And then as a third year, we have typically 6 calls. So only around 12 calls total over the course of the residency. We do 3 weeks of home calls for the VA SCI unit as a second and third year. This typically I think one resident has gone in over the past couple of years, and typically in a given week might get 2 to 3 calls at most. And most of the time the nurses are very good there, so we don't typically get calls like after 8 p.m. So very light on those home calls from the VA side. And then we also have a total of 6 weeks of night float that we cover, 3 weeks in the second year, and then 3 weeks in the third year. I think one of the important pieces too is just the quality and caliber of our faculty. We have a large faculty of over 30. And I think it's a great mix of more sort of seasoned pros and full professors, as well as younger recent graduates that could be kind of helpful. So one side of it, you get that sort of experienced edge, and then the other side, you have residents or faculty that were recently residents and can kind of relate with you a little bit better and can kind of understand where you're coming from and have a better scope of what you may know and what you may not know. Which is helpful. And we've also hired quite a few of the faculty that have come through our program too, which is helpful. So they know exactly some of the training that we've undergone and where the strengths and weaknesses are and how they can kind of help better guide that learning moving forward. As well as most of our faculty have numerous advanced training and fellowships. So we've got numerous faculty that have brain injury trained, multiple ones as well that have been trained in sports medicine, of course, Spain and spine, pediatrics, cancer, spasticity, neuromuscular medicine, as well as stroke. And again, this kind of comes down to the fact that being a large program in a large institution, there's the advantage that we get exposure to some of the more traditional PM&R subspecialties like spine, sports, brain injury, and spinal cord injury. In addition, though, we're also able to get exposure to programs that not all programs may have, such as pelvic floor rehab. Our program director, Dr. Scott, is one of the national leaders in this, as well as cancer rehabilitation. Dr. Kai in the picture right here is neuromuscular trained out of neurology, fantastic to work with EMGs, as well as pediatrics, wound care, burns. Dr. Kowalski is on faculty, is one of the leading experts in burn care. As well as advanced management and spasticity. We just opened up one of the first fellowship programs in spasticity, as well as we've recently opened up an adult CP clinic led by the chair, Dr. Kim, which is great to kind of, as we transition those patients from the pediatric side to the adult side, how do we sort of better care for those patients, as well as how do we care for these sort of chronic conditions that we typically associate with childhood, but can stay with patients as they age into adulthood. A little bit more about our training facilities. So one of the main ones that we do is in Parkland Hospital, famous for, I guess, 2 things. One, the assassination of JFK came to Parkland. And the second one that many of the medical students might remember is the Parkland formula, which was cool to be on the Parkland's burn service and calculate the Parkland formula in Parkland. The rehab unit itself is located on the 17th floor, which is pretty cool because we're on the top of this hospital, and this is one of the views of downtown Dallas that we get. And all of the patients here do get private rooms, which is also nice. I think Parkland itself is a large hospital. It has 983 beds. It actually has the largest emergency room department in the nation. The nice things and privileges of working for Parkland is there's a program in Parkland called the or PFA, Parkland Financial Assistance. So this is a comprehensive, this is a charity program that essentially can provide comprehensive, nearly free healthcare for low-income individuals, which is amazing that we can provide not just inpatient care, but also rehabilitation care, DME care, follow-up care, medications. And so it's really a privilege to be able to treat people and deliver the care that they need independent of their ability to pay, especially in rehab when patients will often go through these major life-changing events. And the last thing that we want to do is to add additional financial barriers and hurdles to trying to get them to recover as best as possible. The rehab unit here is 24 beds. Typically, there's 2 residents that cover this service. And this is what we do as a PGY2. So we have 2 rotations in Parkland. Clemens, which is the, yes.
5-minute warning.
Okay, no problem. Clemens, I'm almost done. Clemens is the major teaching hospital. We don't spend too long here. Most of what we do is on the consult side, trying to triage patients. And one of the interesting things here is you can actually do an art tour, as shown by some of the beautiful demonstrations in the bottom right. This is the Zale Lipsey is one of the primary rehab hospitals from the UT Southwestern side of things. There's a sky bridge that goes across to Parkland, and it's approximately 1 mile or so from the main campus. Most of Zale is for inpatient rehab. However, importantly, there is neurosurgery does have a spine service here. And there is a neuro ICU, which is great. It's under construction right now, but that will be coming back shortly. So whenever you've got sick and crashing patients, it's great that you can easily consult the ICU team. And if need be, we can sometimes step them down to the ICU. And so we don't have to wait for transport, which is very helpful to have. The rehab here is 2 separate floors and there's 48 beds. And this is where we do brain injury, spinal cord, and the medically complex and transplant services. We also work at the Dallas VA Center, primarily first and second years is spinal cord. We also do EMG, MSK, and a TBI rotation here. And as shown earlier, there is a specialized ultrasound curriculum led by Dr. Merchandani. We also work at children's. This is a large children's hospital. Second year, we do the inpatient rotation. Third year, we do an outpatient rotation, but we do some consults as well as the setup, as I mentioned, about the adult CP clinic led by our chair, Dr. Kim. We also work in Presbyterian Dallas. This is a 4th-year rotation where we get to a better experience in terms of patients that might be the private IPR side of things for those that don't want to stay in academic physiatry. As I kind of show here, not all patients have to be multiple transplants and extremely complex. Sometimes they can just be a general bread and butter rehab patient, as is more traditional with inpatient rehab. Some of the other sites that we have across campus, Sprague, Austin, Spine, and there's a couple other ones too dotted around the DFW area that we can get exposure to. The research program that we have here, relatively strong, is part of the Burns and TBI model systems. There's Dr. Pinto is one of our fantastic brain injury researchers that got a NIH grant recently. We've also got an interesting thing of Shark Tank, where the program itself will, we have an internal competition for a pot of money. I think it's around $9,000. Which can be very beneficial for those that need some startup funds or just some funds to travel to present their research at various conferences. Some of the annual events that we have the PM&R resident retreat here. We have a flag football match with the attendings. And there's a PM&R research day where we bring in national speakers from across the country, as well as the spasticity day. So this is one of the residents here doing virtual reality spasticity injections, which is cool because you get tactile feedback actually as you perform these injections. I think one of the important pieces too is that there's a strong camaraderie between both the residents and faculty. Everybody works hard, but everyone also kind of enjoys each other's time and company and gets to kind of socialize above and beyond medicine.
Dr.
I'd like to thank everyone's time.
Oh, perfect. You have 2 more minutes.
Oh, okay. I'm finished here. Yeah, if anyone has any questions, feel free to contact myself, the other chief residents, our program director, Dr. Scott, or administrative questions can go to Mrs. Isabel.
Hi, I'm Dr. Scott. I saw a question in the chat about pelvic floors, so I figured I'd take that since that's my thing. So our residents spend 3 half-days, a mandatory minimum with us in the pelvic floor program, but you do have a lot of selective time. And so we have definitely had residents who did quite a lot more when they wanted to. And we've had residents who we trained for months straight and we were, and they graduated and went on to do pelvic floor. So it's kind of, we don't.
Oh,
Nope, Dr.
yes,
Scott.
you.
There we go.
I think I was talking, nobody could hear me. All right. The thing for pelvic floor, we only have like 3 half days mandatory, but people who want to do more can definitely do much more, spend their selective time with us in pelvic floor and really learn from us. So
Thank you.
Perfect.
Any other
Thank
questions?
Yeah,
Or
I
move
think
on?
there's one more. Elena asked if your program is IMG friendly.
Dr. Scott?
yeah, I'll take that too. I mean, we look at every application. We do have one resident right now who is on a visa, so it's not an automatic no. And we just take everybody as it comes. I will say, I mean, the competition in PM&R is fierce right now. The latest stats that came out with, it's just PM&R in general. We're the second most competitive non-surgical specialty right now. So it is tough, but we don't automatically rule out anybody in our program.
Perfect. Thank you so much, Dr. Simmons, Dr. Scott.